Not long ago, this young Peruvian mother was emaciated and weak. Her HIV infection was raging out of control. Because of family demands, the regimen's complexity, and the medicine's side effects, she couldn't keep up with her treatment plan. For fear of discrimination, she asked us to call her Carmen.
I would only take the medicine when I would remember, or only when I wanted to. And so I went to the doctor, and they did some tests, and the doctor told me that my viral load was way too high, and my test results were poor.
Now, a trained volunteer coach, called a health promoter, visits Carmen at home almost every day.
I didn't have anybody who would come visit me and talk with me. She helps me with my pills. She comes here and she plays with my daughter. She talks to me, she gives me advice, she takes me to a doctor. And that gives me joy, knowing that somebody who is not my family is with me and is supporting me.
Working with Peru's Ministry of Health, the volunteers are trained by Partners in Health, an international medical group that serves low-income people. The visits ease the isolation that can make long-term illness worse.
Discrimination still exists, and we have to work against that, little by little providing patients with our support and our affection. I think the level of confidence and the strength of the relationship you manage to build with your patients, that's what makes them want to follow your advice.
The head of the local program says visiting health coaches can prevent crises by catching dangerous problems early.
If there's a fever or nausea or headaches, home visits allow us to avoid a rapid decline. Because once an infection takes hold, if you don't respond quickly, it can turn deadly very fast.
Clemente's family was terrified he would die from infections of HIV and tuberculosis.
I was like an empty bag. I was dead. Because of my health, I didn't have energy to do anything.
Now, Clemente is strong enough to carry passengers with his transport business. He credits his health promoter.
They keep track of our medication. They're with us. They give us moral support. They talk with us. They tell us about the experience of other people. They motivate us to be able to do well and not to abandon treatment.
Sticking with treatment benefits patients, their families, and communities, lessening the burden of infectious disease. Sponsors of the Health Promoter Program say it can also be effective almost anywhere for patients with non-infectious diseases, like diabetes, hypertension, and heart disease. Gary Stryker, Global Health Frontline News.